Many parents ask, why is my autistic child having speech delay? So if you are asking this question, you are not alone. And most importantly, it is not your fault or it's not your parenting fault, poor parenting. Okay. So speech delay is very common in autism and it usually happens for several reasons working together and not just one single cause. Good morning, parents, ladies and gentlemen. I'm Dr. E. All right. So today I would want to discuss on autism and speech delay. Okay. First of all, in autism, the brain processes language differently. The area responsible for understanding and producing speech may develop at different pace or connect differently. Okay, so sometimes the brain get underconnected, sometimes get over-connected. Okay, so because of this, many autistic children understand much more than they are able to express. Meaning that most of the time, do you realize that autism children usually they have no problem with understanding command, but they have problem with expressive speech. Okay, so they may know what they want, but turning thoughts into spoken words is difficult. This does not mean they are not intelligent. It simply means their brains work differently. Okay? So, another common reason is sensory and auditory difficulty. Some autistic children are very sensitive to sound. Normal voices or background noises can feel overwhelmed or even painful. When listening becomes so stressed, the brain may avoid focusing on the speech, which the brain will go into a shutdown mode. Okay? And it does affect language learning. Another reason is social communications difference in autism child. Remember, parents, speech is not only about talking, but about social motivation. You are motivated to speak or to talk to your friends, to your fathers, to your mom, to your grandfather, and to anyone. But however, some autistic children do not naturally imitate sound or feel the needs of use words to communicate. Instead, they may pull an adult hand, points, bringing objects to show you what they want, or sometimes they throw tantrums or steam to get what they want. This does not mean they do not want to communicate. This is just communicate in a different way. Okay. Another reason, some children also have motor planning difficulty. What is that? They may know exactly what they want to say, but their mouth, tongue, lips do not coordinate well to produce speech. This makes talking frustrating, stressful, and over the time, the child may stop trying to speak because the anxiety start to build in. Okay? So another factors which actually affecting speech development in autism, often being overlooked, but very important, that is biological factor. Okay, so what is biological factor? Before that, speech development depends not only on therapy, but also on the child gut health, nutrition, immune balance, and brain energy. This is what we mean by biological factor. So many autistic children struggle with constipations, bloating, reflux, and food intolerance or sensitivity. The gut and brain are closely connected. And when the gut is uncomfortable or inflamed, okay, the brain may have difficulty focusing, learning, and producing speech. For example, huh? when you are having, we normal adult, when we are having gastric or very severe type gastric, and we are required to do presentation, or we are required by our boss to carry out a task. So ask yourself, you have pain in your stomach, and in the same time, you need to work, you need to carry out a task. So do you think that you are able to complete the task, or do you think that there is a difficulty in completing the task? So same goes to autistic child. Okay, whenever they have gut inflammation, they have the pain, they have difficulty in focusing, learning, and producing speech. Okay, so another biological factor is nutritional deficiency, which nutrient like iron, zinc, magnesium, vitamin B12, folate, vitamin D, omega-3 fatty acid, and etc. These vitamins help to support nerve signaling and language development. When these nutrients are low, okay, which are very common in autistic children because most of them they are picky eater, the children may appear inattentive, slow to respond, or having delay in speech progress. Okay, inflammations and immune imbalance may further interfere with brain communication. That is another important biological factor. Inflammation and new immune imbalance. That's why your child is having a lot of skin allergy, frequently falls sick, frequently admissions to hospital. Okay, so all this can cause stress on the nervous system, make it harder for the brain to process and express language. Okay, some children may have reduced cellular energy or brain energy, meaning that the brain tired easily during learning and communication tasks, which this linked to a condition called mitochondria dysfunction, which I'm not going to discuss further in this presentation. Okay, so because of this, speech therapy often work best when combined with dietary and medical support. Simple dietary approaches such as reducing highly processed food, artificial addictive, excessive sugar, and food that trigger gut discomfort may help to improve attention and regulation. Some families find benefit in structured diets such as gluten-free, casein-free, but this should be individualized and guided by professionals like the doctors and dietitian or the nutritionist. Okay, supplement support, yes, is very important, but you may also be considered under medical guidance. Common example, as I said just now, include probiotics for gut health, omega-3 fatty acid for brain functions, magnesium for calming and regulation, zinc and iron for cognitive support, and vitamin B vitamin for speech and nervous development. Remember that parents, supplements do not replace therapy, but they can help prepare the brains to respond better to therapy, okay, or during learning. Medical support is sometimes needed to address constipation, reflux, sleep, anxiety, and attention difficulty. Sometimes in cases like seizure, or that's why seizure, in cases like seizure, it does affect speech development. So when a child, example, when a child sleep better, did he feel physically comfortable and that's why he can focus more easily? Speech therapy and learning become more effective. This is one of the example. Okay, so the most important message for parents to remember is that speech delay does not mean speech absent. Many autistic children speak later than expected. Some start with single words, some use picture or AAC first, and some develop speech gradually over the time. Different timing does not mean no future. I always believe with the right support, including speech therapy, sensory regulations, biological and medical care, home strategy, and the most important is parenting support, parenting patience. Many autistic children become effective communicators. Bear in mind, Not every child will communicate in the same way, but every children or every child deserve a voice. Your child is not broken. They are developing differently, and with understanding and support, progress is always possible. I'm Dr. E. So I will continue with my next part of autism and speech delay in my next presentation. I see you again. Thank you. Bye.